Good evening, everybody. I am Dr. KrishnaPrasanthi, Senior Consultant Physician from Tirupati, Andhra Pradesh. Today, it's great pleasure for me to be the brand ambassador in the Defeat Diabetes campaign launched by Research Society of Study of Diabetes in India. Before giving my talk, I express my gratitude to Dr. Bansi Sabu sir, Dr. Sanjay Agarwal, Dr. Amit Gupta, Dr. Vasant Kumar sir, and all the legendary diabetologists and physicians for taking this wonderful initiative in educating the people. The purpose of this campaign is for the 100 days we have to reach 100 million Indians and we have to make them to aware about the diabetes. The aim for today's Defeat Diabetes campaign is we have to test, we have to track, we have to treat. So 3 trees are very important in this Defeat Diabetes campaign. My topic for today is prevention of diabetes, more so relevance in this COVID pandemic. We know that diabetes is a huge medical, social, psychological, economic problem which has been faced by almost every family in our country. Though we stand second to China globally, still we have 77 million diabetics right now and the expected number by 2045 could be 130 million. Pathetic to say that 57% of Indians, they don't know that they are suffering from diabetes. In our country, because of poverty, because of ignorance, because of innocence, because of lack of awareness, because of lack of facilities, lack of infrastructure, many of our people, they don't know that they are suffering from diabetes. In spite of educational status, in spite of social level, in spite of living in rural urban areas, many people, because of lack of awareness and fear about the diabetes, fear about the diagnosis of the diabetes and lifelong complications, many people are having inertia to come for testing for diabetes and for tracking for the diabetes. Our aim is prevention is better than cure. You know that diabetes is a lifestyle disorder. It's a pan-metabolic disorder. It's not only the glucose metabolism, we have to think about the lipid metabolism and we have to think about the protein metabolism. Our aim as any clinician or physician is, main thing is we want to have the good quality of life to the patient. If you are not diabetic, please come and test for yourself that whether you are going to get diabetes or you are having a hidden diabetes. If you are already a diabetic, please come for regular follow-up. Please come for tracking of diabetes. We want to track for your all complications. We want to go for secondary prevention. We want to take care of your heart, take care of your kidneys, take care of your eyes, take care of your nerves, and we want to give a good quality of life. And already, if you are a diabetic, if you are in a good tracking, if you are taking a good lifestyle modification, we want you to have a good treatment. Our aim is patient should have a good quality of life. The other important thing is, now why do you want to take care about diabetes now? Because COVID pandemic is a really given a great oversight about what exactly is happening to the health infrastructure in the country. Once we in the March 2020, when we are seeing good number of cases of COVID-19 in the first wave, we didn't understand what exactly is the pathophysiology and why we are getting all these kind of cases. Initially we thought it's only a pulmonary disease. Initially we thought it's only a ARDS, that is a lung complication, and many patients were admitting in ICU, and we are in the process of learning what exactly is the COVID, SARS-CoV-2 virus, how it's going to cause the pathophysiology, why some people are becoming diabetic. But in the COVID second wave from March 2021, lot of insights, lot of research articles, lot of publications and lot of awareness has been coming in our scientific fora that many of the non-diabetics are becoming diabetes with COVID-19 infection. In the post-COVID era, we are seeing good number of diabetics, and pathetic to see that many of them are young diabetics. So this is one of the alarming situation in the country. Already we are facing a burden of diabetic patients, undiagnosed diabetic patients. We are facing the burden of the pre-diabetic patients. We are already facing the burden of the gestational diabetic patient. Added salt on to the fire, we are getting post-COVID newly detected diabetic patients. The second part is already a known diabetic patient who is having very good blood glucose control after getting the COVID infection. Many of the patients are having the blood sugars of 300, 400, 500, 600 blood sugars, and many of them were admitting in ICU. Many of them were requiring the oxygen supplementation. Many of them were on NIV supplementation, and many of them had prolonged admissions in the ICUs and a prolonged recovery. When we are starting analyzing the data on this, is diabetes related to the chronic complications in the COVID? Is diabetes is related to morbidity and mortality in the COVID? Is it the blood sugar level which is going to determine the prognosis in the ICUs? All these questions has been coming into the minds of the scientists and also the clinicians. The third part is we are giving steroids in the management of diabetes because we know that COVID is a prothrombotic state, procoagulant state, and it's a pro-inflammatory state. We want to prevent the cytokine storm. We want to prevent the ARDS. So when we are increasing the doses of the steroids, escalating the doses of the steroids, dexamethasone or methylprednisolone, we have seen that the blood sugars have been increasing, jumping to hips and bones, and again patients are going for opportunistic infections. Either it could be a secondary bacterial infections or fungal infections, and we have seen good number of the black fungus infections colloquially called by the public, that is the mucormycosis. Again, when we started analyzing that, is it because of the high blood sugars the patient is getting the fungal infections, or is it because of the steroids the patients are getting these fungal infections? So in this COVID pandemic, it has given a wide opportunity for us to learn about the diabetes, to learn about the complications, to learn about the management of the disease, and what to be done. What to be done is an important question for us, because our aim is we should not see that the patient should be suffered because of the complications. So how do you want to prevent the diabetes? We know that the prevention of the diabetes is by the lifestyle modification for any newly detected diabetes, or for any mild diabetes, or for any young diabetics. When the fasting blood sugar is around 120 to 130 milligrams per deciliter, when the postprandial blood sugar is around 160 to 180 milligrams per deciliter, when the HbA1c is less than 6.5, always we go for the lifestyle modification. What is the best lifestyle modification we want to go? Number one is the exercise, physical activity. So physical activity has to be increased for many of our patients in this COVID time. But what exactly is the problem we are facing? Either in the lockdown, or because of the isolation, or because fear of going to the crowded places in the public parks and everything, many of us stopped going outside for walking or jogging or swimming or into the common gyms like that. So many of them confined themselves into the houses and they started gaining the weight. The other thing is, what other side of the coin we are saying is the work from home, online classes, software professionals. So adults and girls and boys are sitting in the houses continuously. The digital time has been increased to 8 to 10 hours. Again, the weight gain has been increased. So what exactly we don't want to do in the diabetes, that has been happened in the COVID era, so that the physical activity is not being taken care by many of us. So for non-diabetic patients and also diabetic patients. The other important thing what we have neglected in our COVID management is giving the proper diet plan to the patients, because many of us were running for the immune booster diets. Immune booster diets is, many of the patients, they wanted to increase the diet because they want to increase the immunity. So many immune booster diets were coming, like they used to take more number of nuts, more number of fruits, more number of whatever thing they want to eat, so that they are gaining the weight, they are increasing the carbohydrate count, they are increasing the blood sugar. When we ask them to have a good nutritionist advice, many of the people, because of the lack of availability, lack of affordability, lack of accessibility, they used to depend on us, and because of lack of time and lack of structured nutritionist advice from our centers, many of us will give a common diet plan that may not be tailor made for any of the individuals. So what exactly is lacking is a proper nutritionist counseling is the need of our in the COVID pandemic that has given wide opportunities for many of the nutrition studying students either in the universities or in the colleges, so that we can utilize the services of the PhD nutrition students so that we can do the best for our patients. Then what exactly you want to see in this, we have to understand. So what we are seeing is many of the patients, they are unable to match between the calorie count and the physical activity. Many of them, they work for 8 to 10 hours in a day and they continuously eat and they don't take proper diet. They continuously go for carbonated drinks and they go on eating junk foods and everything because of the Swiggy, Zomato and so many things coming, meals on wheels and everything. People used to take more calories and they are burning out the less calories. Again, added on to that, again in the home isolation, again in the quarantine, again in this COVID pandemic, the increase in the calorie count, decrease in the physical activity, getting a COVID virus infection, increasing the blood sugars, again the patient is going for a vicious cycle. So we have to motivate each and every person, whether they are diabetic or non-diabetic, whether they get COVID infection or they are not getting the COVID infection, they have to take care of the regular exercise at least 150 minutes per week or at least 30 to 45 minutes per day. At least for 5 days in a week is mandatory, depending on their physical fitness, whether they can go for walking or jogging. Many of our patients will be telling that they are having the knee joint pains, they are having the back pain, they are having the neck pain, they are having the giddiness, and the orthopedic surgeons told that they are not supposed to do for walking. But at least what we have to tell is sitting is equivalent to smoking. Sitting kills you. So at least once in every hour you have to move for at least 10 minutes so that it will have a good metabolic effect and it will give a good metabolic control in your blood sugar management. The second part is, in your diet plan, you have to keep the proper proportions of carbohydrates, fats, proteins, green leafy vegetables, fruits, nuts and everything, depending on your affordability, depending on your accessibility, depending on your renal function. This is very, very important because many of our patients, diabetic patients, chronic diabetic patients may be having chronic kidney disease and they are not supposed to take any fruit juices. They may be having the fluid restriction. They can't follow the whatever diet we are telling at large for any COVID patient. They have to take the consultation of the nephrologist. The same holds good for the cardiac failure patient or a severe cardiac problem patient, or a patient is a type 1 diabetic, very lean diabetic. They cannot go for a severe diet restriction. When a patient is a pregnant, a type 1 or type 2 diabetic, when she becomes affected with the COVID, again we have to take care of the nutritional plan that she has to take care of the fetus and we have to take care of the mother also. So it should be tailor-made depending on the age, depending on the duration of the diabetes, depending on the comorbid conditions. And the third thing what we have to take care is the treatment part. Many of our patients, because of so much of information is available in the WhatsApp and social media, many of the patients are taking treatment from other patients, and many of the less qualified doctors, they are taking the treatment from different sources, different systems of medicines like allopathy, Ayurveda, homeopathy, Unani, naturopathy, yoga, and they are preparing their own recipe like thing and they are taking care of the treatment so that they are landing in the trouble. Always we tell that as allopathic doctors, we respect all systems of medicine. They are all having their own line of follow-up. They are all having very good things in their systems of medicine. But if 2 or 3 systems of medicines are combined, and if you are giving a different diet plan, different management plan, different complications treatment plan, it will be difficult for every treating doctor that we may be missing to diagnose any of these complications. So I request all my patients to take care of the blood sugar, to take care of the diet, to take care of the exercise. And now what we are learning is stress plays a major role in the increasing the blood sugar levels. If you are more worried about COVID, if you are more worried about your finances in COVID, if you are more worried about what is going to happen about your future in the COVID, your blood sugars will rise. So this is very, very important that unless your stress levels are kept under control, either by doing a proper meditation or going for any natural methods of your relaxation, or by doing proper yoga techniques, or spending a good quality of time with your family, that will give you a stress relieving booster. And once your stress levels are decreased, then definitely your blood sugars are coming down. We have seen many of our patients that when patients are admitted in ICU, when patients are hearing the news about the loss of their spouses or friends or relatives, their blood sugars are shooting up. So anxiety levels and stress levels are very, very important in determining the glycemic control, and a good stress buster should be there in decreasing your stress. Another important thing is the sleep hygiene. Many of the COVID patients in the post-COVID time, when they are coming to our OPs, they are telling that almost for 2 to 3 months they are not having the good quality of sleep. Hardly they are sleeping only for 2 to 3 hours, and this is a common complaint in the post-COVID time. So we should not advise like we want to give any sedatives or like that, but we have to advise a lifestyle modification. We have to advise relaxation techniques, and most important thing is 2 hours before going to sleep they should not have the digital connections like any mobile phones or any WhatsApp or something. That they should have a very screen free time before going to the sleep, with a almost like lukewarm milk or some serene music, that will have a good quality of sleep. Sleep will increase your immunity. Always I tell to my patients, don't run after the immune booster diets. Your happiness, your decreasing stress, your a good quality of sleep will be acting as your immune booster. So the prevention of diabetes, more so in the COVID pandemic, is by proper diet, proper exercise, a good sleep, decreasing your stress, good relaxation techniques, a proper treatment plan from a qualified doctors. Whenever you are having any doubt, consult your doctor. Many of the doctors are going for a digital consultation or teleconsultation or a WhatsApp consultation. Don't take your own decisions when you are having the high blood sugars. If you are having any comorbidities like a heart disease or a kidney disease or any past history of your stroke, or any cancer patients, or any chemotherapy or any immunosuppressant therapy, don't take your own decisions. Take care of yourself by your family doctor or your treating physician or a clinician or a specialist. Then definitely you will be in the safe hands. So this is about what we are thinking, the prevention of the diabetes. Now I want to give one important this thing is Defeat Diabetes is a very important program. Why? Because if you see that the D in the defeat shows that we have to detect diabetes early. Early detection of the diabetes, either because of your symptoms. What symptoms will make you to come to the doctor? Either by taking more amount of water, or if you are passing more urine, or if you are taking more amount of food, if you are having weight loss, you are having any genital or skin infections recurrently, you are having extreme weakness, you are having blooding of vision, you are having any shoulder pains and restriction of movements of the shoulder, or any unexplained symptom, or any low grade fever like that, please check your blood sugar. Many of the patients in my practice, for practicing for more than 2 decades, I understood that the first thing when you say that you are having a high blood sugar, immediately they say, no, I don't have this diabetes, this laboratory is wrong. Denial is the first part when you make a diagnosis of the diabetes. So accept that any person on the earth can get diabetes. Any person on the earth, irrespective of the age, can get diabetes, more so in COVID pandemic. And many patients tell to me that, madam, my RT-PCR is negative. Why I am having high blood sugars? Probably because of your good immune status. You may be having a very low viral load that may not be detected by the RT-PCR. You may be having suffered from mild infection which you are unable to diagnose. So we have seen that a primary contact of a severe COVID patient may be having the high blood sugars in the practice also. The second E is in the defeat is the education. Education about the diseases in our country is the very, very important thing to be taken care of, more so in COVID pandemic. Why? Because proper education from proper persons in proper time will give the best message to the patient. If the message is coming from a non-qualified person or a disqualified person or from a wrong source, a wrong information, that information may be costing the life of a patient. This has been observed, this has been proved many a time in our practice. So a proper health education is the need of the hour, and we heartfully express our gratitude to RSSDA headquarters for taking this social media initiative so that we can collect to millions of our country people, so that we have to educate them properly. Why? Because all these days we are taking care only that the pulse, BP, respiratory rate, temperature are our vital signs. But COVID has changed the face of the vital signs, that everybody, every nook and corner, every person is able to understand the examining the SpO2 by pulse oximeter. Even a villager also says that my oxygen saturation is 95% or 96%. So when a common man is able to diagnose his oxygen saturation by a pulse oximeter within a short span of time, why can't we make a blood sugar as the fifth vital sign that every person, even in village, irrespective of the literacy status, can diagnose his blood sugar level? This has been the motto, and this is the aim of taking this Defeat Diabetes program. So our aim is not only the pulse, not only the blood pressure, not only the respiratory rate, not only the temperature, the blood sugar measurement has to be taken care by all the doctors, all the paramedics, and whoever is working at the field level, either ANMs or ASHA workers or any other specialist. When the patient is going to an orthopedic surgeon for any aches and pains, it has to be mandatory that that orthopedic surgeon should check his blood sugars. If a person goes to an ophthalmologist, he is not a known diabetic but complaining of his blurring of vision, then that is the responsibility of an ophthalmologist to check the blood sugars. If a person goes to a dermatologist with a recurrent fungal infections, that is the responsibility for a dermatologist to check the blood sugar level. So he implies that it's not only the educating the patients, we have to educate the doctors, we have to educate the politicians, and we have to make them to incorporate into all the field level programs of detecting blood sugar for each and every patient. Then F. What is that follow-up? Follow-up is lost for most of the patients. In my practice, I understood that because of the economic reasons, and for elderly people, many of the poor people, they have to depend on others for the travel or financial support or getting any physical and moral support. That person may be a daily laborer. He can't lose his wages and everything. So they will wait for any alternative source of help for them. In our state, Andhra Pradesh state, we are having 104 services of the fixed day health services, where the ambulance will be going to the respective village once in a month with all the doctors and the paramedics, where they check the blood sugar and blood pressure, and they will give the medicines there itself. And if they feel that that patient has to be referred to the higher institute, they will be referring to the community health centers or to the any tertiary care hospitals like that. So this is how we have to take care that every patient in every village has to be followed up regularly, so that we can detect new complications. For example, in the post-COVID patient, when patients are coming and telling to me, Madam, I am having palpitations. When we started auscultating, we are seeing good number of arrhythmias. We are seeing tachycardias of 120, 130, 140. We are seeing bradyarrhythmias. We are seeing frequent ectopics. And once we started analyzing that in the post-COVID, not only the blood sugar alone, not only the saturation, we have to examine the heart rate and we have to auscultate so that we cannot miss any arrhythmias in this patient. Another important thing is evaluation. Once the blood sugars are shooting up, we have to exclude whether the patient is suffering from any infections or not. It could be a pulmonary infection in the lower lobe of the lungs, it could be a urinary infections, or we have seen that patient may be having a simple fungal infections like candidal infections or aspergillosis or fungal infections. So evaluation, a physician will always search in finding out what exactly is the cause of the high blood sugars. One side will decrease the blood sugars by giving either oral anti-diabetic drugs or insulin, but other side simultaneously will be evaluating that why this patient is having high blood sugars. Many of the patients will be asking me, Madam, I am not a diabetic before getting COVID. Really, will COVID cause diabetes? Yes. The COVID SARS-CoV-2 virus, it enters in the body to the ACE2 receptors. It may be involving the insulin producing beta cells of the pancreas. We have seen in the literature that some of the viruses also cause the diabetes, like Coxsackie virus and the mumps virus. Like that, we have seen that in recovery almost 20 to 50% of the recovered COVID patients will be having the high blood sugars, and some may be asking, is it a transient or permanent? Hopefully it should be transient, or the patient, it may be the precursor for future diabetes. I have been seeing hundreds of post-COVID diabetic patients, and we are having very good glycemic control within 3 to 4 months of detecting the high blood sugar, initiating on the insulin, again intensification of the insulin, titrating the dose with the oral anti-diabetic drugs. So you have to remember IIT. IIT stands for initiation of the insulin, intensification of the insulin, titration of the insulin has to be done. Many of the patients are having myth that you are starting insulin, is it lifelong? No. It is not lifelong. We always educate the patient. It is only temporary. We want to give rest to your beta cells of the pancreas. We want to decrease the glucotoxicity. We want you to expose to the higher risk of infections. We want you to take care of yourself. Don't worry. And once you are giving a soothing words, once you are giving a good counseling either by yourself, by your staff or your diabetes educators, definitely the acceptance of the patients is very good. The other important thing is the awareness. Awareness by the patient regarding his disease, regarding his complications, and regarding how he has to go for the self-monitoring of the blood glucose. And really, in my 20 years of practice, this 1.5 year practice has really increased the usage of the glucometers by the patient. Acceptance has been increased because they don't want to come to the doctor frequently. They are checking the blood sugars with the glucometers and they are connecting to us digitally. This is really, COVID has given lot of problems, challenges to the government, to the doctors, to the patients, to the families. But the opportunities given by the COVID are, we are increasing the infrastructure, we are moving digitally, we are connecting to the patients digitally, and we are connecting to the doctors virtually. We are using the social media platform, we are connecting to hundreds of people directly at a single visit. So we are able to communicate our message. So this awareness about the self-monitoring of the blood glucose, awareness about regular follow-up, awareness about early diagnosis of the complication, because we are seeing good number of cases coming with blurring of vision. Recently we are seeing good number of cases with eye problems like purulent discharge from the eye, uveitis. So many complications are there. So patient will not think about his eye when he is suffering from COVID. He always think that I am getting COVID, so I get only cough, I get only sneeze, I get only low grade fever, and he is not worried about his eye. But we have to tell that any new complaint in your body, any new change in your body, you have to intimate to us so that we can give an early referral. So awareness about the disease, awareness about the complications, awareness about the monitoring, awareness about the treatment. When you are giving a new drug to the patient, you should be able to explain that this is how the patient may be having some complication with the drug. And the last T is what the 3 T's in our Defeat Diabetes program is the 3 T's. We have to test, we have to track, and we have to treat. In this treatment part, many of my patients will be asking, Madam, why do you want to start insulin? If your sugars are 500, if your sugars are 400, I feel definitely you need insulin temporarily and definitely will be taking off your insulin. I want to go for only medication. What is the best drug for me? As per the government of the India guidelines says that the gliptins are having a very good role, and when you are starting the patient on the metformin and sulfonylureas, you should be having a word of caution. When the patient is on SGLT2 inhibitors and the thiazolidinediones, you should give a very strict caution, and we have to sometimes withdraw the drug also. So when the patient is on this kind of medication, what is his already existing medication, what is the dose he is taking, whether he has skipped any doses or not, because What happens in this COVID is many of the patients are not having good appetite. They are unable to take the food, they are having loss of taste, they are having loss of smell, they are unable to eat food, so they are not taking food. What a diabetic patient routinely thinks, I am not taking food, why I should take my medication? That's how they stop the medication. After 5 days or 1 week, they will be landing in diabetic ketoacidosis, the sugars will be going high, and you see ketonuria, and patient may need ICU admission. So we have to instruct sick day rules for any diabetic patient, that they should not skip the doses of the oral anti-diabetic drugs or insulin, but they have to use in a moderate or decreased doses of the drug. Now another important concept in this defeat diabetes program is not only a diabetic patient, all the family members also should come for testing and tracking. This is very important, because undiagnosed diabetics are more in our country, and lot of inertia is there for coming for testing and tracking. In our country, what exactly is happening is, we see two extremes of patient. One set of patients, or they'll be having a very rigorous monitoring almost once in a day. They maintain good food diary, they may have good exercise diary, they note down how many steps they are doing regularly, they have the food plan and everything, they are meticulous. But this percentage of population is very less. More than 40 to 50% of the patients, they are not worried about the diabetes. They don't think that it's a disease also. They take once in a month medication, government supply, they'll be taking once in a year, they'll be consulting the doctor, and when we ask them to go for any eye checkup or like that, they'll be laughing at us. But why we are worried now is, gestational diabetics are increasing. Almost 1 in 7 live births are having a pregnant diabetic mother. Hyperglycemia in pregnancy has been increased. Already pregnant mothers may be suffering with COVID, and even before 20 weeks of gestations, people may be having the high blood sugar. So we want to take care of the mother, we want to take care of the fetus, we want to have the safe delivery, we don't want to have any obstetric complications during the delivery or in the perinatal period. So we'll be getting referrals from our OBG colleagues that what to be done for us. So always we tell to our pregnant diabetic is, take care of yourself. So in nutshell, if you see a diabetic patient and a COVID patient, or both in a single family, what are the best practices, good clinical practices to be followed? We always tell to our old chronic diabetic patients, wear your mask perfectly. When you are coming for consultations to the hospitals also, let it be with an appointment. Let you have a very short stay in the waiting rooms and the hospitals. Take care of your annual checkups regularly. Don't skip, don't give a reason that it's because of the COVID. Check for your heart, liver, kidney, and again you will be having a digital or teleconsultation for another 3 to 6 months. And when you are recovering from COVID from ICU, you may need a prolonged follow-up with multi-specialists, and definitely you need to have a regular follow-up for another 3 to 6 months. How long is the post-COVID? It could be 3 to 6 months. What are all the expected complications? Why? Because a good metabolic management is needed for a COVID diabetic patient. Why? It's not the blood sugar alone. We have to check the blood pressure also very rigidly, and a good antihypertensive medications has to be started depending on the need of the patient. And statins are having very good role in the post-COVID management. Any high blood cholesterol levels, it has to be taken care. In post-COVID, we have seen good number of patients with very high triglycerides of 600, 800 to 1000 milligrams per deciliter. So not only the blood sugar, the blood pressure, the blood cholesterol has to be taken care by many of our clinical practitioners, so that we will not miss any complication. Always in post-COVID period, we better to have one ECG, better to have one chest x-ray, and if the patient is having any other complication, even sometimes thyroid dysfunctions have been reported in the diabetic patients after getting COVID. So it's a holistic metabolic management is the need of the hour, and what our aim is as clinicians, we always educate the patients for prevention of diabetes, prevention of complications of the diabetes, prevention of amputations, prevention of any dialysis, prevention of any coronary artery bypass surgery, prevention of any laser photocoagulation. If we are taking very good control, if we are giving a good education to the patient. The other common question I will be getting is, when I should start my exercise after recovering from COVID? How should I start? When should I start? With how much time I should start my exercise? So it all depends on the duration of the COVID, how long you have been affected, are you had a supplementation with your oxygen, are you really fit? Because in the post-COVID, aches and pains, myalgias, arthralgias, extreme fatigability is very common, even up to 3 months also. So depending on your physical fitness, start slowly, go slowly, and slowly increase your exercise, because we have seen that many of the celebrities, many of our doctors, immediately going for a gym or going for a vigorous exercise may precipitate arrhythmias. Why? Because COVID itself is a prothrombotic condition. Again, we are seeing that many patients are having oral anticoagulant supplementation. Sometimes already they may be on aspirin, clopidogrel, like that. This kind of dual therapy may be increasing the bleeding risk also. Sometimes a severe headache, sudden loss of consciousness, sudden loss of vision, sudden loss of movements on one side of the body. It has to be given a good alert that patient is having an impending stroke. So COVID is a huge global crisis, affected almost each and every family in our country. Though we are going for good vaccination, only 50% of our country is getting vaccinated. All diabetic patients in our practice, we should motivate them that they should go for COVID vaccination. Lot of inertia is there, lot of myths are there, lot of fears are there, and most of them, they don't want to go for vaccination, they go for native medicines. Already those patients who are on annual influenza vaccines, definitely they have to take their regular vaccination along with that COVID vaccination. Many patients are asking me, after taking COVID vaccination, we will get fever, we are not supposed to take painkillers, what we are supposed to take? So many of these questions will be asked by my patients. I will be telling that don't worry, everybody will be having 1 or 2 days of mild fever. You can go for a simple paracetamol supplementation. Irrespective, irregular, or I mean say indiscriminate use of the NSAIDs or etorecoxibs or diclofenac or aceclofenac should be condemned by most of us, because we know that diabetics, a chronic diabetic, will be having a fragile kidneys. Even 1 or 2 tablets of this NSAIDs may have the deranged renal function, and you see that the eGFR may be coming down. So the final message what I want to tell is, take care of your patient, take care of your patient holistically.